Let's learn about the OPTIMA clinical research trial. In recent years, North America has seen a dramatic increase in substance use disorders related to prescription opioid medications. This has led to a concerning rise in deaths due to drug overdose. There exist medications that treat opioid addiction called opioid agonist treatment. These medications work by reducing a person's cravings and feelings of withdrawal when they're not using drugs. In 2017, researchers at the Canadian Research Initiative in Substance Misuse set out to compare two different types of opioid agonist treatment. They wanted to know if a medication called buprenorphine-naloxone was as effective at reducing opioid use as methadone. They called this clinical research the OPTIMA trial. There are some significant differences between these two types of treatments. The main difference that researchers were interested in is that buprenorphine-naloxone allows patients to take their medication home quicker, usually after 2 weeks. Comparatively, methadone requires patients to go into a clinic or pharmacy every day for treatment for the first several months. The OPTIMA trial took place in 7 cities across Canada. There were participants in British Columbia, Alberta, Ontario, and Quebec for a total of 272 people. All of the participants were assigned to one of two treatment groups, either the more flexible treatment of buprenorphine-naloxone or the more regularly prescribed methadone. So what did they find? By performing routine urine drug tests, they found that the percentage of participants not using opioids on any single visit was the same for the buprenorphine and methadone groups. In other words, both treatments had similar results, which means that prescribing buprenorphine flexibly through take-home doses is just as effective at reducing opioid use as methadone. There are many other findings that came from this trial. Both groups reported an increase in quality of life, which was reported sooner for the buprenorphine patients. Drug-related negative events such as withdrawal, overdose, and low sex drive were also similar in both groups. Also, 74% of participants in the buprenorphine group were able to receive take-home doses, compared to 21% in the methadone group. The results from OPTIMA have opened the door for further research. The important point to take away from this trial is that more flexible and independent treatment options for people with opioid use disorder is just as effective as supervised methods. This raises the question, how can we provide Canadians with more flexible models of care that puts the patient's needs first? After all, a patient feeling trusted and listened to goes a long way for the success of any treatment.